Okay guys, today we need to talk about BPC-157 because this peptide has been hyped to the moon. Joints, gut healing, tendon repair, which is a big reason people take it, inflammation, and even anxiety. And while some of that sounds amazing, you gotta know the pros and cons just a little better before you start taking it. This video is not anti-science, it's not fear-mongering, it's about understanding what BPC-157 actually is, what the research really shows, and where the big unknowns are so you can make informed decisions instead of following internet hype. Let's get straight into this, guys. All I ask from you is just to hit the like button down below. It tells YouTube this is worth showing to more people. So if you like learning about health from a scientific perspective in a calm and collected way, consider subscribing too. So first, what exactly is BPC-157? BPC stands for Body Protection Compound, and it's a 15 amino acid peptide originally isolated from human gastric juice. In animal studies, it appears to play a role in tissue repair, angiogenesis, and modulation of inflammation. Most of the excitement around BPC-157 comes from rodent and animal studies, where it showed impressive healing of tendon repair, ligament repair, muscle injury, gut ulcers, and even nerve regeneration. This is why athletes take it when they get a sports injury. And when people hear that, they think, okay, why isn't everyone on this then? Why shouldn't every athlete have this in their backup? Here's where the first reality check comes in. Almost all of the strong data we have is from animal models. There are very few high-quality human clinical trials, especially long-term trials. That doesn't mean it doesn't work. It means we don't fully know how it behaves in the human body over time, especially when used repeatedly, injected, stacked with other peptides, or taken by people with underlying conditions. But I do want to mention the nuisance here. BPC-157 might not technically be patentable as of yet. That means Big Pharma can't make enough money off of BPC-157, and that means it's not getting marketed to your local doctor or hospital or anywhere else in the healthcare system. So that can be an issue why the trials are taking forever, right? Someone needs to make money off this for this to push through. The question is who gets to keep the prize money, but that requires a separate video. Let's talk mechanism, because this is where things get interesting. BPC-157 appears to influence growth factors like VEGF, nitric oxide signaling, and fibroblast activity, which explains why it may promote new blood vessel formation and tissue repair. That sounds great for healing tendons or gut lining, but here's the uncomfortable question. What else relies on angiogenesis and growth signaling? Tumors do. So does abnormal tissue. Scar tissue does, and while there is no definitive proof that BPC-157 causes cancer, the long-term risk of chronically manipulating growth pathways in humans has not been established. That's a huge gap people gloss over. If you already have a tumor you aren't aware of, can BPC-157 cause that to accidentally grow? It's a question to definitely think about when you're weighing the pros and cons. Another thing people don't talk about enough is dose and routes of administration. In studies, BPC-157 was often used orally or injected locally in animals at very controlled doses. In real life, people are injecting it systemically, stacking it with TB500, taking it daily for months, or buying it from unregulated sources. The unregulated sources part is huge because I've seen some sketchy websites selling this. This introduces variability in purity, sterility, degradation, and dosing accuracy, which is a big deal when you're taking and talking about peptides. Don't you want the real deal? And let's talk about regulation for a second, because this matters. BPC-157 is not FDA approved for human use. It's sold as a research chemical, which means there's no oversight ensuring consistency or safety. The FDA and WADA have both raised concerns, and BPC-157 is banned in competitive sports. That doesn't automatically mean it's dangerous or it doesn't work. And I want to say that again. That doesn't mean it's dangerous or ineffective, but it does mean you are essentially self-experimenting, and that you should know of 100% before taking it. Now here's where I want you to pause and really think. A lot of people report feeling amazing on BPC-157. Less pain, faster recovery, improved gut symptoms. Your friends at the tennis club or golf at the country club might tell you how it's changed their life. That may be real and their stories may be true, but short-term symptom relief does not equal long-term safety. We've seen this time and time again in patterns before in medicine, hormone, peptides, growth factors. They often feel incredible at first and the consequences only show up years later. There are also some under-discussed side effects people report: fatigue, brain fog, dizziness, anxiety changes, sleep disruption, and paradoxically worsening pain in some cases. These aren't well studied, but they're common enough anecdotally that they shouldn't be just ignored. Just because something is healing doesn't mean it's always regulating tissue correctly. Let's say if you've already taken the BPC-157 and your pain level didn't improve or change, the reason behind that is because it actively modulates the inflammation, right? And remember, inflammation isn't always bad. In fact, inflammation is a critical part of proper tissue repair. If you interfere with that process at the wrong time or the wrong tissue, you can actually disrupt normal healing signals, leading to increased pain, stiffness, or irritation. And since it may sensitize local nerve endings, it can temporarily increase nerve sensitivity in some people, which can explain the nerve problems that arise afterwards. That means more pain signals get sent to the brain even if structural damage hasn't really worsened. But let's say you're considering a BPC-157 and the pros outweigh the cons for you. First, don't treat it like a supplement. This is not magnesium or vitamin D. It's a bioactive peptide that affects signaling pathways in your body. Second, ask why you're considering it. Is it to shortcut rehab? Avoid physical therapy? Push through an injury you shouldn't be loading yet? If so, then that might be a red flag. Third, understand that the safest, most evidence-based issue healing tools still remain kind of boring. You got progressive loading, nutrition, sleep, collagen synthesis support, and time, which a lot of people really don't have. Most people don't have the time to repair their tendons and tissues the natural way, and really are shortcutting, in my opinion. If this video made you stop and think or saved you from jumping into something without understanding it, hit that like button for me, because that tells me you want more science first, no hype breakdowns like this. And if BPC-157 worked wonders for you, let me know in the comments below. Would love to hear your story. For now, drop your questions or experiences in the comments, and I'll see you guys on the next one.